I'm so tired today. Oh God. Just came back from the doctors and he said I got high blood pressures. And what is even this thing called hypertension? Where does it come from? I know I eat well, I do everything right. I know I exercise sometimes, but I'm lazy, I know. And he put me on this medication. He said beta blockers. Yes, yes. What are even beta blockers? And to talk of it all, he said, I can't take just one. Oh my goodness. I'm going to be taking all these pills. I don't even understand. You know what? I'm just going to go lie down and have some rest because I'm tired today. I'm like, I took like forever at the doctor's office. I'm just going to go lie down on the couch and have a quick nap. Then maybe when I get up, maybe I'll Google something or about beta blockers because I had no clue what was going on in that doctor's office today. Oh my god.
Hi there. Hypertension is the increase in vascular resistance. There are two types of hypertension. There are primary and secondary. 90 to 95% of patients diagnosed with hypertension are diagnosed with primary hypertension, which is caused by genetics. Secondary hypertension is caused by renal artery stenosis, chronic renal disease, primary hyperaldosteronism, stress, sleep apnea, hyper and hypothyroidism, pheochromocytoma, preeclampsia, and aortic coarctation. The normal blood pressure range is less than 120 milliliters of mercury for the systolic pressure and less than 80 milliliters of mercury for the diastolic pressure. The three primary goals of an antihypertensive are to reduce the volume of blood, stroke volume, and heart rate.
Hypertension occurs from continuous vasoconstriction within the arteries or an increase in blood volume. This can ultimately interfere with the perfusion to the body, which can lead to complications like stroke, renal failure, and myocardial infarctions. So hypertension is extremely common in the United States. In fact, it affects 1 in 3 people. And usually this condition doesn't show any specific symptoms besides the elevated blood pressure readings. So that's the main reason most people aren't even aware that they have the condition. However, in some cases, headaches or dizziness may be present. So factors that can contribute or place a person at risk for developing hypertension could include obesity, hyperlipidemia, cigarette smoking, alcohol consumption, excessive sodium intake, and heredity. And hypertension can occur within any population, but it is most prevalent in the African American communities. Now, thankfully, this condition can be managed by lifestyle modifications and by taking antihypertensive medications. And these medications can include things like diuretics, ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and beta blockers.
It looks like you're concerned about your blood pressure medication. So beta blockers reduce cardiac output by diminishing the sympathetic nervous system response to decrease basal sympathetic tone. Thus, vascular resistance is diminished and blood pressure is lowered. But beta blockers also reduce heart rate, contractility, and renin release. The higher the level of renin, the greater the response to the medication. Non-selective beta blockers inhibit beta 1 and beta 2 receptors so that the heart rate drops first, then the blood pressure, while bronchoconstriction occurs due to the unopposed sympathetic tone. Cardioselective beta blockers are preferred because they mainly act on beta 1 rather than beta 2, and bronchoconstriction is less likely to occur. The real value of beta selectivity is maintaining a renal blood flow and minimizing the hypoglycemic effects of beta blockage. Beta blockers should not be used with patients with second or third degree atrioventricular block or sinus bradycardia. Patients with COPD should not be given non-cardioselective beta blockers as they interfere with the lung function. The side effects and adverse effects that are associated with beta blockers should not be overlooked. They include decreased pulse rate, lower blood pressure, and bronchospasms. Even with the side effects present, beta blockers should never be abruptly stopped. The risk of rebound hypertension, angina, dysrhythmias, and myocardial infarction are present when you do that. Beta blockers can also cause dizziness, insomnia, depression, fatigue, nightmares, and even some sexual dysfunction. The liver's ability to convert glycogen to glucose in response to hypoglycemia is also compromised when beta blockers are used, so diabetics should use with strict caution. I hope that helps.
Nurse is talking to you today about the medications included in the classification of beta blockers. Did you know that beta blockers are also called beta-adrenergic blocking agents, and they're used to reduce your blood pressure? Although there are many more beta blockers included underneath this classification, I am only going to mention 3 to you. The 3 drugs that I'm going to mention to you are called acebutol, bisoprolol, and metoprolol. And these drugs work by relaxing blood vessels, slowing your heart rate to increase the blood flow, and lowering your blood pressure. Your doctor will prescribe these medications to you to prevent, treat, or improve symptoms. By taking these drugs, you may experience some cold hands and feet, fatigue, weight gain, depression, shortness of breath, and trouble sleeping. I'm going to be talking to you about the nursing process of these antihypertensive beta blockers. The first step of the nursing process is going to be the assessment step. In this step, we will obtain any medical history, any herbal history from the patient. We will obtain your vital signs. We will report any abnormalities while comparing it to the patient's baseline. We will check lab values periodically for liver and renal function. The second phase of the nursing process will be the nursing diagnosis. We will decrease cardiac output related to the variations in the blood pressure, non-compliance to drug regimen related to the cost of multiple drugs ordered, the sexual dysfunction related to the side effects of the beta blockers, and the deficient knowledge related to the inexperience with beta blockers. Now, the third phase of the nursing process would be the planning phase. The patient's blood pressure will be decreased and returned to the normal value. Patient will state that he or she will take the medications as prescribed, correct? Patient will verbalize the importance of following the beta blockers regimen. And the last and final step of the nursing process will be the nursing intervention. This is when I will come in and I will monitor your vital signs, especially the blood pressure and pulse. Lastly, I will monitor the lab values, especially the BUN, the serum creatine, AST, and the LDH levels. And that'll be all for the nursing process.
Case study. Number 1 case study. The nurse should know that which of the groups of antihypertensive medication would be less effective in African American patients. Is it the alpha adrenergic blockers? Is it the diuretics? Is it the beta blockers or the calcium blockers? The answer is beta blockers. Beta blockers medication do not work effectively in African American patients. It could be effective if combined with other antihypertensive medication like the diuretics. Number 2 case study says, which statement from a 50-year-old patient placed on a beta blocker indicates need for further teaching? Is it when the patient says, I will not take herbs with this medication, or B, I will comply with my drug regime, or C, I will report dizziness, slow pulse rate to the healthcare provider, or D, I do not need to contact my care provider before taking any OTC medication? The answer is D, because any OTC medication a client is taking should be reported to the healthcare provider. I hope this information gives you a better understanding of this medication. Thank you and have a great day.
Oh, yeah. Oh, my goodness. That was wonderful. Like, was I actually dreaming or what was going on? Because, like, I had this strange dream about beta blockers and everything it does to the human body. And oh my god, now I really understand what is like, why I'm taking it, and what the medication really does to the system, what I should look out for. And yes, wow, I know a dream, but this was a great one. Like, it was like I was getting a lecture all over again. Wow. I want to dream like that again in the future because that was a great dream about beta blockers. Wow. That's good. Oh, now I know why I'm taking the medications. Beta blockers. Okay.